Welcome to our exploration of peripheral arterial disease, PAD, a significant vascular ailment impacting the peripheral arteries, particularly in the lower extremities. Throughout this detailed guide, we'll journey through the intricate landscape of PAD, delving into its pathophysiology, clinical manifestations, diagnostic methodologies, and treatment approaches. Comprehensive comprehension of PAD is paramount for healthcare practitioners, equipping them to deliver optimal care to individuals grappling with this challenging vascular disorder. In PAD, atherosclerosis plays a pivotal role, instigating the accumulation of plaque within peripheral arteries. Initially, lipids, inflammatory cells, and extracellular matrix components infiltrate arterial walls, gradually narrowing and stiffening vessels over time. As plaque burden increases, affected artery lumens constrict, impeding blood flow to distal tissues. Consequently, PAD hallmark symptoms like intermittent claudication and limb ischemia arise. In advanced stages, inadequate blood supply precipitates severe ischemic complications, including rest pain, tissue necrosis, and ulceration or gangrene formation, necessitating swift intervention to avert limb loss and related morbidity. In the early stages, peripheral arterial disease often presents with intermittent claudication, marked by limb pain or cramping during physical exertion, alleviated by rest. Patients may also report limb numbness, weakness, and fatigue. Progression of peripheral arterial disease manifests as skin atrophy, pallor, limb coldness, and diminished pedal pulses. Advanced peripheral arterial disease stages may lead to ulceration, gangrene, or critical limb ischemia, necessitating urgent intervention to prevent amputation. Diagnosis typically begins with the ankle brachial index ABI, with values less than 0.9 suggesting peripheral arterial disease. Further imaging, like duplex ultrasound or angiography, may confirm diagnosis and guide treatment. In managing peripheral arterial disease, various medical approaches aim to alleviate symptoms and reduce the risk of cardiovascular events. Antiplatelet therapies like aspirin or clopidogrel are commonly prescribed to mitigate thrombotic risks. Vasodilators such as colostazol enhance blood flow and exercise tolerance by promoting vasodilation and improving blood rheology. Lifestyle modifications, including smoking cessation, diabetes and hypertension management, and regular exercise, play pivotal roles in peripheral arterial disease management by addressing underlying risk factors. Revascularization procedures like bypass surgery or angioplasty may be necessary for patients with advanced or progressive peripheral arterial disease to restore blood flow and alleviate ischemic symptoms. Peripheral venous diseases encompass a spectrum of conditions that significantly impact vascular health. Deep vein thrombosis, DVT, poses a severe risk, with blood clots forming in deep veins, predominantly in the leg or pelvis, potentially leading to life-threatening pulmonary embolism. Chronic venous insufficiency results from venous valve failure, causing blood pooling and contributing to varicose veins, venous ulcers, and lower extremity edema. Superficial venous thrombosis, also termed thrombophlebitis, involves clot formation in superficial veins, often preceding deeper vein clots. Management strategies for peripheral venous diseases typically involve anticoagulation, compression therapy, and, when necessary, surgical or endovascular interventions targeting the underlying venous pathology. Several diagnostic modalities are employed to assess peripheral arterial disease, PAD, comprehensively. 1. Duplex ultrasound. This non-invasive imaging technique combines B-mode ultrasonography with Doppler evaluation, allowing for the assessment of blood flow and detection of vascular abnormalities in peripheral arterial disease. 2. Angiography. Utilized with CT or MRI, angiography offers detailed visualization of the arterial tree, serving as the gold standard for diagnosing and characterizing the extent of peripheral arterial disease. 3. Ankle Brachial Index, ABI. A simple and cost-effective test, ABI compares blood pressure in the ankles to that in the arms, aiding in identifying and quantifying the presence of peripheral arterial disease. 4. Advanced imaging techniques. MRI and CT angiography provide high-resolution visualization of vascular anatomy, enabling further evaluation of the extent and severity of peripheral arterial disease. Revascularization strategies play a pivotal role in managing peripheral arterial disease. 1. Endovascular procedures. Minimally invasive techniques like angioplasty and stenting are often the initial choice for restoring blood flow, especially for patients with localized arterial lesions. These procedures aim to open narrowed or blocked arteries, enhancing blood flow to the affected areas. 2. Bypass surgery. In cases of extensive or complex arterial disease, bypass surgery may be necessary. This surgical intervention involves creating a detour around the blocked artery using either autologous, patient's own, or synthetic grafts. By redirecting blood flow, bypass surgery helps improve distal perfusion to the limbs. 3. Amputation. In instances of advanced or critical limb ischemia, where revascularization options are limited, amputation may be considered as a last resort. Although drastic, amputation aims to prevent further tissue loss and life-threatening complications. However, this decision is carefully evaluated, balancing the potential benefits of limb salvage against the risks associated with amputation. Comprehensive vascular care for patients with peripheral arterial disease involves a multidisciplinary approach integrating various specialties. 1. Vascular surgeons. These specialists perform surgical and endovascular procedures aimed at restoring blood flow and preventing limb loss in patients with peripheral arterial disease. 2. Cardiologists. Cardiologists play a crucial role in managing underlying cardiovascular risk factors such as hypertension, dyslipidemia, and diabetes, which contribute to the development and progression of peripheral arterial disease. 3. Podiatrists. Podiatrists specialize in providing comprehensive foot and wound care for patients with peripheral arterial disease. They play a vital role in preventing and managing complications such as ulcers and gangrene. 4. Physical therapists. Physical therapists develop tailored exercise programs to improve claudication symptoms and enhance overall cardiovascular fitness in patients with peripheral arterial disease. Exercise is crucial for improving circulation and maintaining mobility. 5. Nutritionists. Nutritionists advise on dietary modifications to address underlying risk factors and promote overall cardiovascular health in patients with PAD. A healthy diet can help manage conditions like hypertension and diabetes, which are common contributors to peripheral arterial disease.